and what are the different types of stillbirth, how it is classified in obstetrics and gynecology, how do the gynecologists classify that, whether what types of stillbirth are there, whether it is early stillbirth, late stillbirth, or term stillbirth. So in succession to that video, this video, I'll be mainly discussing about the risk factors what are associated to stillbirth. So basically stillbirth is a condition where the intrauterine fetal demise has taken place and there is no detection of heartbeat in the unborn baby. So if there is no heartbeat detection, so the fetal demise has already happened and the child is having on ultrasonography, the doctors they find that the baby has already gone, the baby has died inside the mother's womb. So this, there are certain risk factors what are associated to stillbirth, and stillbirth, it is mostly occurring, I would like to emphasize that stillbirth is the term only used once the pregnancy has crossed 20 weeks of gestation. Below 20 weeks of gestation, if the fetus dies, the heartbeat has stopped. So this is given another term what is called as miscarriage. After 20 weeks of gestation, if the heartbeat of the baby has not been detected, the baby has died inside the mother's womb after 20 weeks of gestation, it is called as the stillbirth. So basically there are certain risk factors what predispose a woman to stillbirth, and basically it has been found that there is as such no the definitive cause of it has not been found up till now, but stillbirth can happen in any of the pregnancies. It has not been specified that whether it's your first pregnancy or second pregnancy or third pregnancy. In any of the pregnancies the stillbirth can happen, and there is as such no specific criteria that it has to be first, second, or third, whatever. It stillbirth can happen in any of the pregnancies what is happening. So basically there are certain risk factors what are attributed to it. So first risk factor is the age. So if the maternal age, so this condition of stillbirth, it is mostly found that whether if it is a teenage pregnancy, that the expecting mother is below 18 years of age, so there is a greater risk of having a stillbirth in a teenage pregnancy. Apart from this, if the gestational age of the mother is above 35 years of age, so the chances of stillbirth can still be seen. So the age of the mother, the age of the expecting mother, the maternal age is the very important risk factor what needs to be taken into consideration. So if it is a teenage pregnancy below 18 years, or if the maternal age is exceeded 35 years or above, so there is a risk that there might occur a chance of having a stillbirth. The next important condition is the health condition of the mother. So if the women who are expecting, they are having certain kind of a health issue such as diabetes is there, persistent high blood pressure is there, or certain thyroid conditions are there, certain blood clotting disorders are there, and lupus. So such conditions, they predispose a woman for having a stillbirth. And apart from this, if there is certain bleeding tendency disorders related to bleeding tendencies, so in that condition also stillbirth can be seen. Apart from this, if there has been previous pregnancy complications are there, for example, if a woman has undergone a previous complication of pregnancy as a stillbirth, so there might be a chance that if in the previous pregnancies of her, if she has faced miscarriages or stillbirth, so there might be a chance that in the upcoming pregnancy she might still experience a stillbirth. Apart from this, there are certain substance abuses. For example, the women who are in the habit of taking alcohol or smoking during pregnancy, so this increases a manifold chances of having a stillbirth, because certain chemicals such as these alcohol, these recreational drugs, alcohols, drugs, substance abuse, the intake of caffeine, so certain these chemicals also predispose a mother for having a stillbirth in the conditions of persistent high blood pressure in pregnancy, which is called as preeclampsia. This also predisposes a woman to having a stillbirth. Apart from this, there is certain type of diabetes what is called as the gestational diabetes. So if during the period of pregnancy, if the mother is having gestational diabetes, so stillbirth can be seen in such a mother. The next important risk factor, it can be seen in the form of the maternal obesity. So if the mother is very much obese, so this also has been found to be a very important attributable factor for having, for causation of a stillbirth. Apart from this, if the mother is expecting multiples in the womb, it can be a twin pregnancy, it can be a triplet pregnancy. So if the mother is expecting multiple fetuses or multiple babies inside the womb, if it is a twin pregnancy or a triplet pregnancy, so this condition also predisposes for having a stillbirth. Apart from this, this has been found that if the mother is having certain kind of an infections of the birth canal, such as the fungal infections, the bacterial infections, the viral infections, any kind of a, this kind of an infection, if it is the mother is having, so this also becomes a very important causative agent for having a stillbirth. And there are certain findings what can be seen in the fetus as well. For example, if the fetus is having the intrauterine growth restriction, so the baby is not developing properly in conditions of any kind of a birth defect. If the new developing baby is having any kind of a birth defect, such as any error in the genes, so or in the conditions of anencephaly. So anencephaly, it is a medical terminology what is given where a certain part of the developing fetus's brain is unable to develop properly. So in conditions of anencephaly also, if there are certain neural tube defects in the developing baby, so there are certain birth defects, so these all conditions also predispose for having a stillbirth. Lastly, the very important condition, stress. So stress has also been attributed to one of the very important causative agent for having a stillbirth, because during the conditions of stress, the body's adrenaline secretion is so much excessively increased. So that also might predispose for having a stillbirth, particularly the women who are experiencing certain kind of a life stress or relationship stress or financial stresses if they are having. So this has been found in studies that women during the pregnancy, if they are having predisposed to certain kind of stresses in their day-to-day life, so that also causes a particular kind of a that also predisposes them for having a stillbirth if there are relationship issues with their partners. So these all conditions, these are the very important conditions what I would like to emphasize. Although in some cases of intrauterine fetal demise, this cannot be prevented and have as such no explanation. So if 1 out of every 3 cases of stillbirth, the one case goes basically undiagnosed, and the healthcare professionals are unable to explain as to why the stillbirth has happened. There are certain conditions what are associated with the developing fetus. If there is a compression of the umbilical cord, if the mother is after 28 weeks of gestation, it is mostly advised that the expecting mothers, they are not supposed to lie on the back while sleeping during pregnancy. So if once they are lying on the back, it is seen that the umbilical cord, which is supplying the oxygen and blood supply to the developing fetus, so that gets hampered, and once that oxygen and blood supply to the fetus is getting hampered, so actually the condition of fetal distress can be seen. So if there are issues of the umbilical cord compression is there, or umbilical cord prolapse is there, or in conditions where the placental abruption is there. So placental abruption, it is a condition where the placenta separates out from the uterus prematurely, or if there is a premature water break is there, the amniotic fluid leaks due to certain the premature rupture of membranes is occurring. So all these conditions, these are the risk factors what can be seen as a risk factor for having a stillbirth. So students and viewers, in this video I have tried my level best to give you in simple terms. I have enumerated all the important risk factors what can be associated for having a stillbirth. So the age, particularly the age, the recreational, the substance abuse, the stress, the type of pregnancy, and one more thing I would like to emphasize, if the mother is having the first pregnancy, so this is also a condition which can predispose to having a stillbirth. The health conditions of the mother, if the mother is having diabetes, thyroid disorders, blood coagulation disorders are there, coagulopathies are there, thyroid disorders are there. Apart from this, if she's having a previous history of miscarriages or stillbirths, or if she's having an obesity is there, in certain kinds of multiple pregnancies there is high blood pressure, gestational diabetes. So all these factors, all these risk factors can be attributed to the maternal complications. The fetus complications can be there, where the tissues, the brain of the fetus is not developing properly, the umbilical cord compression is there, the placenta is separating prematurely from the uterus. So these all conditions are which can predispose for having a stillbirth. So students and viewers, this was a very short discussion. If you still have any queries or comments, you are most welcome to comment me in the comment section. And students and viewers who are new to my channel, who haven't subscribed, subscribe, and don't forget to press the bell icon so that you can be further updated for my upcoming videos. Thank you for watching.